My name is Dr. Tyler Tolbert,
And I'm Dr. Soren Poppy,
and you're listening to the Fix Podcast.
your source for all things implant dentistry.
Awesome. So like so while we're on the subject of CE, what's kind of on the cutting edge for you right now? Like what kind of courses are getting you excited?
Man, that's a good question. I feel like I've taken all of them at this point. I'd like to take some more like perio type courses, which we'll probably get into a little bit as like what's like my future looking like. But I took a year I was living in California. I did take like a tissue grafting course with Dimitri Paramigos.
Nice.
He's become a good friend of mine. I did a little tissue grafting in my residency, but nothing like that I would ever remember how to do. I do a lot of free gingival grafting now.
Cool.
I think in the last year, I've fixed a couple of mine and more of other people's like oral enteral communications. So just, tissue management is a huge thing that, I'd like to learn more about. And, like connective tissue grafts for sure. Free gingival grafts, like to me is like, it's just whatever, like you just do them. And, I think more people should learn how to do it because it's pretty hard to screw up. But I would like to learn some more tissue grafting around teeth. Of course, the more like remote anchorage stuff, it doesn't matter how many courses you take, you're going to learn something new from every single person.
Right. Yeah.
This just, I feel like I'm starting to run out of courses, but it's like, as soon as I start thinking that, something else pops up. At one point I dabbled into learning a little bit of design.
Yeah.
Again, that's something that I want to do in the back of my head, but then every time I sit down to do it, I'm like, I don't want to do this.
This is hard.
Yeah.
This is hard. There's a lot of steps. It's immaterial and it's not in my hands. Yeah. I totally understand that.
So,
yeah. I took a course with Wally Renee over at the MOD Institute. Just trying to learn how to do like digital removable. And I figured that would give me a pretty good, understanding of, just exocad and how that works. And yeah, I mean, I loved it. And I think on that day, I felt confident that I could design like an immediate denture and some partials and stuff. And then right after that, I was like, yeah, if you put that software in front of me, I wouldn't know the first thing to do.
Oh yeah, dude, I have an exocad on.
Yeah.
I couldn't even, I don't even know how to open it. It's like hard just to even open the application. I don't think people realize like designers don't get enough credit. Like their job
It's
sucks.
an incredible
It
skill.
is so hard to be a good designer and be, good, quick, efficient. But again, it's something, like Wally Renee's, like, the Mod Institute, that's on my list of things to do. I took,
great course, by the way. Yeah, it was a fantastic course.
For sure.
I don't need to shit on it. It's me I'm shitting on. Yeah.
Yeah. Oh, dude, I hear only great things about his courses.
Yeah, no, it's great.
I took the first like 2 COIS courses of kind of the COIS curriculum. I was signed up for another one in March. That again, I signed up for like a year and a half ago. It's like when they ask the patient like, what are you doing in 6 months for your next cleaning? People are like, dude, I don't even know what I'm doing tomorrow. You had to book these courses like a year and a half ago. So I ended up having to cancel that. I think I'm signed up for another one later this year. I should probably figure out when it is.
Yeah.
But like, you have all these like, have like Dawson, Spear, Coyce, whoever knows, like train of thought of like occlusion and treatment plan and things like that. Before I kind of decided which one I wanted to like resonate with, I kind of like did what I could research wise. And like, I feel like I identify with the Coyce the most. So I took his first course and like pretty quickly became obsessed along with everyone else. And that's why his courses are sold out for like a year and a half in advance now, because it's like, he does not say something if he doesn't have a research article to back it up. And I think there's very, very, very few CE courses that you will go to where whoever's lecturing does like these people, and I'm not bashing them because like, I don't want to read research all day long either, but like people say things without like the studies to back it up. But like he truly like in like your manual, you get, it's like, he says something and it's like, okay, these are my sources, and they're recent too. Like, it's not like they're from the 1980s. It's like, they're all recent articles. And it's like, holy cow, like this is what like the dentistry that we're taught we're supposed to practice in school. Like this guy's actually doing it.
Yeah. That's fantastic. Yeah, that's very cool. Well, I mean, I'm impressed too that you've gone so far down the rabbit hole of remote anchorage and being able to use hard tissue architecture to make full arch work. And it's very easy to just kind of once you get comfortable doing that, I mean, you can really just kind of do that and not really be worried about other disciplines, restorative disciplines, soft tissue, which is such a often looked over aspect of what we do, and it couldn't be more important for the long term stability of what we do. The side benefit is you get a lot more practice if you don't pay attention to soft tissue stuff, but it's not exactly productive
Right.
practice.
Soft
That's right.
tissue is not done enough. Like I can't
No,
stress
no.
enough to people like how important it is.
So obviously that's a big note. So where would you suggest people go first for good soft tissue application specific to implants, full arch?
I think like Dimitri Perio Amigos, like I think that they do an amazing job nowadays. They might have a live patient one now, but I did it on a pig jaw. I did take a course down in Tijuana,
Hmm.
which is a hilarious course because it was like an education center where they would also teach implants, and
Yeah.
I was doing tissue grafting around a 3-year-old implant that had still not been restored, had its
Oh
what
my
we
God.
called a Mexican crown, which is just the healing abutment on it. It's like,
Yeah.
why are we whatever,
Oh man.
but
Yeah. Yeah.
I don't know of any live patient tissue grafting courses. I know there is one in Brazil, in Sao Paulo, that
Hmm.
I've heard really good things about. um there probably is something in Tijuana. However, it's like, when people hit me up and it's like, hey, like, what should I learn to do what you're doing or to do full arch? And it's like, man, like, first learn dentures, learn how to flap, learn
Yep.
how to take out teeth,
Hmm.
learn immediate implants, learn tissue grafting, because it all comes together. And, like when I mentor people and new people, it's like, okay, let's look at what's going to take you the longest, right? Like for
Hmm.
your case, because like there's too many people out there just spending like 8 hours on a double arch. Like I hear it from the CRNAs I work with, and it's like
Yeah.
they're like, dude, you have no idea like what we did yesterday. And it's like this was an 8-hour case, and I'm like,
Yeah.
what the
It's
hell took
brutal.
so long? And it's like, make the flap,
Hmm.
taking the teeth out, suturing. Those three things are going to take
Just
the
fundamental
majority of the
stuff.
time. I mean, it's all
Yeah.
the fundamentals. It's like, but people really want
Hmm.
to like skip over the fundamentals and just go
Hmm.
straight to full arch because it's like the sexy thing to do, when like realistically a single posterior implant is going to make you more money in your practice than full arches. Like
Hmm. Yeah.
especially if you're not efficient at your full arch, and I don't care what you charge, you're going to lose money on that case. I mean, yeah, it's
Yeah. And
gratifying
the
to
anesthesia
do.
bill for 8 hours is brutal.
Exactly.
My God.
I mean, but it's like
Yeah.
people, that's what really like kind of frustrates me a lot of it. Like, new people coming out of dental school, like wanting to like, I mean, it's true. Some of them want to go straight to Zygo, but it's like, dude, you have to learn the fundamentals. Like
Hmm. Yeah.
because placing the implants for like, I would say like 80-90% of the full arch cases that I do or anyone does, like to me, the implant placement's the easiest part,
Yeah.
right? It's
Yeah.
like,
It
go
is.
learn how to take out teeth, go learn how to flap like quickly, efficiently, like without tearing flaps, because the
Hmm.
better your flap, the better they're going to heal, the less post-op issues you're going to have. Patient's going to be in less pain.
Yeah.
Um, so, and that kind of goes back to my residency of them forcing
Right.
us, like, you take out a tooth, like, cool, you can do it flapless, but no, we're going to make a flap because you're going to graft it. You're going to put a
Hmm.
membrane in. And so I wish there were more courses on fundamentals than just
Yeah.
people ones like, all right, I want to go learn full arch. I'm like, oh my gosh.
Yeah, no, I totally appreciate where you're coming from. And I think, you know, uh, like in the first part of a conversation where we're talking about how you got into remote anchorage and Zygos, there wasn't a whole lot of CE kind of on the front end. But it was really like you had done so much work to be an efficient surgeon, to know how to do flaps, to understand the fundamentals through your GPR, that you went to one course for Zygos and you were able to do that 8 months later because you had those fundamental skills down so well. And, for me, that's really where my evolution as a surgeon is when I learned that I needed to focus a lot less on drilling implants and focus a lot more on just creating the stage. And in my mind, I was always like, okay, I want to take this case where it's at, and I just want to get it to the point where I'm looking at the arch and it looks like a model. Like it's clean. The alveo is nice and flat and it's round. Anybody can do surgery on a model. Literally anybody. If you see the anatomy, if you see where you need to go, there's absolutely no skill involved. I can say that myself because I have very little skill. But if you just know how to get to that point and establish the case, then everything else is easy. And that comes down to being able to lay that flap very quickly and efficiently and not create a massive bloody mess. Being able to take teeth out very easily so you're not terribly fatigued and seeing stars by the time you get to the point of actually placing implants, right? So if you can just set that stage efficiently, the whole thing is just so much easier. But it's the most overlooked part of it, and everyone just kind of wants to get to that end result, that really sexy post-op CT with implants at crazy angles in remote bone, and I think that really speaks, like your story speaks to that. Now that you've taken tons of courses, great, you've done that, but you're able to utilize those and retain them so much better because you have all those fundamental skills that you established early on in your career, like right out the bat. And it wasn't all about, oh, I'm going to do full arch. You didn't have that in your mind in school, even for the immediate period outside of school. You didn't know you want to do that. You thought you were going to be APA or whoever, I don't know.
Exactly.
Right?
Yeah.
Yeah. But you had all those skills, already kind of laid down. So yeah, no, I mean, I think that's a huge takeaway. And, I get people reaching out to me all the time too about, where do I start? And, it's the fundamentals all the time. And I know a lot of people roll their eyes at that, but it couldn't be more true. And most of the people that come on the show and we ask them, what do they need to do? Like, that's the type of answer you get.
Yeah. And it goes back to dentures, right? Like, to make a good
Yes.
denture, you've got to flap, you've got to take out teeth, you've got to make a good enough flap to where you can really smooth the bone and do your alveoplasty, and you have to suture, right?
Yeah.
And it's so low risk because that's all going to heal. Like, worst case scenario, you got to go back in and like alveoplasty a little bit more, but you don't have the implant aspect of it. And people can try to sue you because your denture doesn't fit well, but like, it's going to go nowhere. But like, as soon as you place implants, like, you've just opened up like Pandora's box of risk. And it's like, dude, go do 100 dentures. You could arguably like, I think like this whole like full arch thing is like becoming like, it's cool to do, but like realistically, like everything else like might be a little more profitable for your office. But it is harder too. Like, I would rather do full arch than I would rather do like a implant like snap denture. Like, that's hard
every day. Oh yeah, it's so hard.
That's so hard. Implants got to be parallel. Like, like bones got to be like extra smooth. Patient management, but like go back to the fundamentals. If you can do that efficiently and well, like the full arch stuff is going to become so easy.
Yeah. No, I couldn't agree more. And two, I wanted to ask you, so you were doing, a fair amount of just going to other offices and doing full arch over there, doing, travel dentistry essentially, right?
Yeah.
So I'm curious about what the dynamics of that looked like. Like, you would just kind of walk in, do the surgery, walk out. Were you responsible for restorative aspect of it? What were kind of like the highs and lows of that experience, and how did it contribute to your career?
So I still do a lot. I'm learning a lot now where it's like I'm a lot more picky of where I go. So a lot of the offices where I was traveling to, it was either like they were kind of doing full arch, but nothing well, or it was like they were doing none. And I was having to teach them the whole kind of restorative process of it. And a lot of the places like didn't have the right thing. So I was, for the longest time I was traveling with a trio. So I was traveling with my iCam,
good for you.
traveling
That's awesome.
with, and I still today like have this little like kind of toolkit I'd go everywhere with. It's like, if like shit hits the fan, like at least I have something that I'm comfortable with. It's kind of like my teddy bear of stuff where it's like, I know that like it's like, it could be little things where it's like a strip screw removal thing, or it's like,
sure.
like an extra, a couple extra like implant drivers, because like, cool, you can drill holes all you want, but if you don't have anything to place the implant in with, like, like it's just like things that I've like kind of like over traveling that I do, and it's in my backpack. Like, it doesn't like, we're going to Vegas this weekend, right? Like it's not going to leave my backpack because it's always in there.
Yeah. I had a Rosen driver confiscated at the TSA one time.
Really? It's under 7
Yeah.
inches. They shouldn't have done that, man.
Well, I mean, I say confiscated. They searched it. They were looking
Yeah.
at it. They're like, "What the hell is this?" And I talked to him about it, and it was okay. But I had to have a conversation.
Yeah, I made the mistake once. I think I had a whole Zygo kit, and I said the word
Oh yeah, that's
I
tough.
said the word drill bit because I was like, oh, this is in my mind. I'm like, this is gonna be really easy for them to understand like what these are. I was like, oh, they're just drill bits for dental implants, and they're like, drill bits, like that's against our rules.
Yeah.
And I'm like, okay, whoa. They're not like
Easy.
real drill bits. Come on now, like.
Yeah.
But I now know like don't.
Yeah, they don't fit in an impact driver.
Yeah, like don't call them drill bits. They're burrs. You know?
Yeah. Dental burrs.
But yeah, the traveling gig is it's good. It's stressful. You know, last year I took 141 flights. It was about 150 odd days in hotels, maybe more.
Wow.
I did. You know, I don't think I did my total calculation of arches last year. I know at the end of last year I'd hit 1,000 arches.
Wow, fantastic.
So yeah, I think last year, I don't even know how many I did last year. But it's good. But again, the thing that people don't think about is like who's doing your post-op, and there are offices that I've stopped going to because I don't know who's doing my post-op. And again, like it's my patient. I did the surgery. It's my reputation. It's my license. You know, if I can't trust who's doing the post-ups or if post-ups are even being done, you know, that's how big infections happen, and that's how people end up in the hospital, and that's how people get sued. So, you know, I know people want to do the traveling gig. It's good. It's great for offices to keep stuff in house, but like you have to be selfish in the fact that it's like this is your license, and you've got to be careful, and you've got to know who's doing your post op, and you've got to know what who the patient is before you even go into surgery too. I mean, the amount of times I showed up and it's like patient. I mean, the most recent case was I was sent to CBCT. I was prepared for it. I showed up. They told me the patient was at 9. Turns out the patient was at 8. 8:30 they call me. It's like, hey man, where are you? And I was like, I'm in my hotel room.
Where are you?
Where are you? And they're like, oh, the patient's here. This was an office like they had brought an anesthesiologist, and they're like, oh, the anesthesiologist here. I'm like, oh, you guys told me 9 2 days ago. I show up, patient's already asleep. You know, walk in the room, like, hey guys, what's going on? You know, whatever. I look down, and there's a denture on the table, and I'm like, okay, well, the CBCT I saw, the patient had teeth.
Oh my god!
So I don't know what this is all about. And it was also weird too, because like the anesthesiologist was like, yeah, she said something about like a sinus lift, blah, blah, blah. I'm like, I don't do sinus lifts on full arch. Like maybe 1 or 2 a year, I might do that. I'm like, this is weird. I'm like, okay, well, so you guys got a CBCT for this patient? Yeah, the other office does, but they're not open today, so we can't get it. And I'm like, well, we're gonna have to wake her up, guys. Like,
oh my god,
wake her up. They take a CT. There is a floating implant in the sinus, one implant that's in just tissue, and it's a quad zygo case with like mega thin zygos, and this office has no zygos. And that was my final straw. I was like,
no,
this is like
absolutely not
terrible for me, but like I feel bad for the patient. So I was like, we need to remove this implant. So I was like, at minimum, I flapped. I opened up the sinus, got the implant out.
Yeah, we'll go fishing, sure.
But after that, I was like, man, like you've really got to know what office you're going to. Again, who's doing your post-ops, who's doing your pre-ops. So the traveling thing, like I still do it. More selective on where I go. You know, I like this year, I really want to chill a lot more this year. Like I feel like I was gone last year more than I was home.
Yeah, that doesn't sound very sustainable.
No, it's
like literally spending half of the year in hotels.
Yeah. I just want to like this winter, I just want to ski.
There you go.
That's all I want to do right now.
Yeah, that's awesome.
And I kind of like am seeing a little bit of a shift of like what I want to do in dentistry. Like I do miss like the kind of like the quote unquote like multi-specialty cases where we're doing some crowns and some single
Very
implants and
cool.
things like that. Like
Yeah.
the more complicated stuff, I like 80% of full arches is just like, whatever, like we'll just toss some implants in. It's a pretty straightforward case, but I do miss like kind of those more complex type cases. So
Yeah.
I'm trying to figure out a way to kind of get back into doing those because I do miss
Okay.
it.
Yeah.
I
Yeah.
want to get back into some like aesthetic type stuff.
Hmm.
So looking at CE, like what's next? I probably some CE for some aesthetics. I mean, like the only veneers I ever did was in dental school.
Hmm.
So it's something I'd like to learn how to do again.
Okay.
The one thing I will never do is insurance driven single tooth dentistry. And
Sure.
it's
Yeah.
not
Yeah.
because I don't want to do it. I don't believe in that. I think that dental insurance is, well, first of all, it's not dental, it's not insurance.
Right.
It's a
Right.
benefit plan.
Yes.
So I refuse to be dictated what I can and cannot do from dental insurance.
Hmm.
So what I want to do eventually is build something where it's like we just do full mouth dentistry.
Hmm. Yeah. No, I definitely think that's really where a lot of this is going because, when we get too into the mentality of that, fixes the hammer, we make everything a nail. Not only is that, I mean, put aside that this isn't good for patients. That doesn't really make sense, and we took an oath type of thing. But it's I think it ends up being pretty shallow. When your only way of thinking about dentistry is in terms of eliminating someone's natural dentition and replacing it with something fake that we know is not going to be, it's not going to outlive the patient in most cases.
Yeah.
I think that that's not as rewarding, and there's definitely a reward that comes from tackling a complex case and being able to, solve the problem, and give someone a fixed rehabilitation for sure. That's great. But there's a world of that with natural dentition as well. That's still very lucrative. It's still very engaging. It does a lot for patients. It makes massive differences. And it's not just about the artificial dentition. It's not just about the implants and all these crazy places. It's about comprehensive dentistry, and
Yeah.
that's really what makes a big difference for patients. And you can do it much in the same vein of, okay, you're going to come in and we're going to do a whole bunch of stuff at one time, and we're going to change your life in one day. And you can do that not just with fixed full arch. You can do it with a whole lot of stuff that's a lot more conservative, that works out more so throughout the patient's lifetime as well. So
Yeah.
I think there's a lot of virtue in that. I respect it for sure.
So what do you like, what goes through your head when you look at a patient that could go either way, right? Like, cause like I'm seeing,
Yeah.
and I'm sure you're seeing it. I think, when I talk to people, like we're all seeing this where it's like, and this is something again, like I don't think talked enough about. It's like,
Hmm.
you have these patients where it's like, we can restore it. We can remove all
Hmm.
your teeth. And it's like, where do you draw the line and like, which way do you go? Cause the patient is always going to take, most of the time, I think they're going to take like the cheaper, faster option, which is generally going to be the full arch.
That's the path of least resistance.
But
Yeah.
like, I mean, dude, the amount of people, like, I mean, I did a double arch yesterday afternoon on a 31-year-old. I mean, granted, like that was her only
Yep.
option. Like she had 8 and 9 were the only crowns. Like everything else was broken off at the root line, like
Hmm.
bombed out. And it's like, I'm like, oh my gosh. But that same day I saw a consult yesterday. This chick was 41 years old. She was missing one premolar and the other premolar is broken off at the gum line. No periodontal disease. Aesthetics was an issue. Yeah. Bite was reasonable.
Yeah.
And a few cavities. And she was like, I want them all out. And I'm like, no.
Yeah, totally. Right, right. Yeah.
But
And she can get it done. Like she'll find a place. Like it'll get done.
I know. And so like I spend
Yeah.
all this time like I pause my day to like educate these people, but
Yeah.
this is what's scary. And it's like, I don't know, like what your rule of thumb on like when you decided to pull the trigger on doing full arch on someone
Hmm.
or either, giving them the restorative plan and doing it yourself, referring them to someone that can do it well,
Yeah.
or just saying, no, like I'm not treating you.
Yeah. I mean, it's not something that's easy to be black and white about it, I think. And first I'm always looking at age is obviously a huge factor. That's probably the easiest one to be looking at. Someone in their 30s, like there's nothing you can do that's going to be permanent. Um, you have to consider that. And assessing whether or not the patient fully understands that there is options is important, because I've had patients that literally just sit in the chair and they're like, I ask them, why do they want to do this? Like, why is this the modality they want to go with? And they've seen multiple doctors and they're like, well, I just don't want to see the dentist again. And it's like, well, that's not, that's not even a reality. That's a fantasy that you've been sold. I'm not selling that. That's not what it is at all. It's just, full arch is not an exit ramp. It's just a different interstate.
Yeah.
And
That requires more maintenance, I think. I mean, that's
it
what I tell
does.
everyone.
Yeah, absolutely, it does. And it's not as easy really as trying to maintain your teeth, because it's not self-preserving, right? Like what God gave us is it's a self-regenerative system. We're doing everything we can in science to recapitulate that and regrow teeth and regrow tissue. And you started with that, like everything else is much shorter. So it's very difficult sometimes when you have those borderline cases, and I think there's probably not enough people saying no when it's appropriate. But ultimately, it does come down to patient autonomy, but also patient education. And if we really feel that we've done our job there, and this really is, economically someone's only option for getting to where they want to go, sure. But they have to understand that there's drawbacks to it. They have to understand this isn't a permanent solution. They have to understand that they might be doing this again. And as long as that's there and we're on the same page, I feel more comfortable about it. But I think that there's a lot of gigs out there where, everyone's just trying to make their month. And, if it's in the chair and someone's willing to say yes, that's about their only criteria. And that's really myopic. And I think it's not without consequences. They're just not immediate consequences.
Yeah. I'm really hoping that, with like the new, basically with like the way 3D printing is going, we can basically do full mouth dentistry under sedation.
Yes.
And immediately load it with like a 3D printed material that might last them, hopefully will last them 5 years. Right.
Yeah.
Like,
Yeah.
and that way we can reduce that cost of saving teeth down,
Right.
when you can print it all like in the same amount of time it is going to for us to print an arch. To me, that's what I'm really excited about in the future is not necessarily just doing full arch, but being able to like save teeth in the same amount of time.
Yes.
And for the same price it is for us to do full arch.
Yeah. No, I totally agree with that. And I think that one of the strongest driving factors that leads patients who do have other options towards full arch is fatigue, because they understand what saving teeth means is they're going to go through a litany of appointments over years of time, and it's going to cost a lot of money, and there's going to be root canals and crowns and stuff that breaks before the whole thing is even done, right? Like that's their perception of it, because it's going to take so long.
But for me, like dental insurance dictates a lot of that mentality, right?
Absolutely.
Because it's like I have this conversation with patients. Sorry to interrupt, but I have this conversations like all the time with patients where it's like, they're like, they roll their eyes about something, right? And I'm like, okay, like let's discuss dental insurance and let's discuss why dentists have such a bad reputation. Yes, there are like the dentists out there that are ethically not doing the right thing because they want to make money. That's in any business, any industry,
Of course,
worldwide. Like you're going to have those people, and it sucks. And I hope they don't have dental license, because like I think that's terrible. But what's happening in dentistry that I see with especially these like insurance driven dental offices, right, is you come in, you've got, I don't know, 8 cavities, 2 crowns. Maybe you have SRP2. Well, your dental insurance is not going to cover all that. Your dental insurance is going to cover like 1,000, like a couple fillings.
Yeah.
And you as the patient is like, well, my dental insurance is only covering this. So in my mind as a patient, and I know this because I've spoken to patients about this, spoken to friends about this, where they're like, oh, well, my dental insurance, so it must not be that important because my insurance doesn't cover this. And I'm like, so, okay, so let's talk this through. So your insurance is only going to cover 1 crown, right? So you're going to get that 1 crown, and then you're going to wait till next year hits. Well, next year you're going to come in for your cleaning, and not only are all the things that were there last year that we found still there, but now they're going to be worse. and
Yeah.
you've got disease in your mouth still. So there's going to be new things. And now we've got this like endless cycle to where it's like the
Chasing our
whole,
tail.
yeah. And that's where the whole, like, other than the shitty dentists out there, but that's where the whole like patient's like, oh, well, like every time I go to the dentist, they just find something new. And it's like, well, no, these are things that we've known about, but you haven't gotten treated because your dental insurance company isn't covering them. But we shouldn't be calling it an insurance company. It's not. It's a benefits plan. It's like I explain to people. It's like I had this conversation with a friend the other day. It was like, okay, hypothetically, you get in a car accident. It's your fault. You knock out your front 4 teeth. You break your leg, right? You pay your $500 deductible on your car insurance. You get a new car. You pay your whatever your deductible on your medical insurance, and they fix your broken leg.
Yeah. It is done. Yeah.
You get $1,000 to fix your anterior teeth. And and they might not even, and if you want to do implants, they might not even cover it. They might just tell you have to get a flipper. Like, I'm like, what is wrong with this?
Yeah, that's not insurance.
Like, this is not insurance. Like, this is what gives dentists such a bad reputation. It's like so frustrating to me. Like, I left the Idaho Dental Association and I don't pay my dues for that. I don't pay my dues at ADAs because like they're getting in bed with these freaking dental insurance companies. I'm like, you guys should be going to war against these people, not taking money from them.
Right. Be the resistance. Yeah, sure.
It's just like, man, I could talk all day about dental insurance. It's like the worst thing in the entire world. But the dental insurance is good for people that have a healthy mouth that have no issues.
Right. Yeah.
You get your cleanings paid for. You get your x-rays paid for. But that's all it's good for.
Yeah. If you got 1 or 2 problems a year, great. But if you're in a rehab situation, it's just not going to go. And then that's why, full arch becomes, fixed full arch with a dentulation becomes the off ramp because there's too many problems that insurance is not going to catch up for.
Well, and these patients wait too long, and then the full arch is their only option. And the other thing I explained to them is like, your dental insurance company wants us to extract your tooth because it's cheaper than a crown, it's cheaper than a root canal, it's cheaper than a filling. Yeah. And guess what?
It can't be retreated.
Yeah. Guess what? They never have to pay on that tooth again.
Yeah.
It's like
they've eliminated their liability.
Let's talk about this. This is a huge problem.
Yeah. Yeah. Yeah, absolutely. And like a lot of these, fixed cases, I mean, patients ask me if they can utilize their insurance. I'm like, yeah, I mean, you're probably, if they've got a lot of teeth, I'm like, yeah, you'll get your insurance maximums. I mean, insurance companies love when they pull teeth, and you'll get that, but they're not going to cover anything else. And that's pretty much what that has amounted to. Like everything you've been paying for, that's what it amounts to, is they're going to help you get rid of your teeth. That's not a healthcare incentive,
No.
But again, we could wax philosophically about insurance for quite some time, but the overarching theme here is a very important point that you made, that digital workflows, comprehensive dentistry, being able to do more at one time and provide solutions for patients is a huge boon, and it's not relegated just to implant dentistry. Like you can absolutely do that with a natural dentition, and I think that's our third wave. Like that's where things are going to be going, because we are able to do much more comprehensive things in a cheaper way, because of the advent of digital and 3D printing and how quickly these materials are advancing. It's absolutely unbelievable. I mean, when we graduated, the things that we're doing now did not exist when we graduated. And like the materials that were out there, it wasn't even a thing. So what we're going to be able to do in the next 5 years or so, with the natural dentition, with crowns, with veneers, you name it, is going to be incredible. And I think you're laying a really good foundation for yourself, in going to, some of these occlusion courses with, Coyce and, Dawson, you name it, to understand those things, because those are going to become a whole lot more important when it comes to working with existing dentitions. So that's fantastic. Yeah,
for sure. So yeah, as far as like what CE I'm taking next, I think that's the type of CE, like, what's that, like, was it the Strupp and Brum? Like, I think I'm going to try to go down
complex. Yeah.
I think I'm going to go try to take that course. Like, I've heard great things. And
yeah. I took it my D2 year, actually.
Really?
Yeah. I went and I shadowed their office and I took their course, and I understood probably 30% of it,
Yeah. I've heard great things, and it's like,
yeah, it's good. They're good guys.
That's the type of, I think that's where I'm starting to pivot a little bit. I mean, I don't know. I feel like it's like ethically it's the right thing for me to do. And that's
Yeah.
going to give me more joy than just ripping teeth out all day long.
Yeah, and you'll see, they post cases all the time that would be, all on X and so many offices, and they've got their whole 4% CHG protocol, and their bonding and what they do. I mean, I've seen them do a full arch case. Like I've seen how they prep and impress and everything, and they've got the in-house lab and they make the indirect temps and stuff, and it's a really beautiful thing. And it was funny because going through Augusta, like we received such a traditional education, but it was very occlusion focused, and it was very analog, of course, and it was stone models and stuff. And here I was in this like super well-renowned cosmetic practice, seeing those same things that we were doing in school, because they stick with those tried and true things, and they're doing amazing dentistry with it, really helping people out and solving problems that so many people just they jump to that off ramp. They just take the teeth out and throw in some screws and call it a day, and there's no art in that, really.
Yep, for sure.
Yeah. So, so let's talk about, so we kind of know where you're headed, in terms of CE and treatment philosophies and different things that you want to kind of open yourself up to. What does that look like for you professionally? Are you still going to be doing the travel stuff? Are you looking to kind of settle in some roots? What's your idea there?
It's hard to give up the travel stuff.
Yeah.
I'm licensed in 5 states now. I'm licensed in California, Utah, Idaho, Oregon, and Washington. And so I'm working with a few different people, looking at taking over some offices, things like that, to, that are full arch or that are trying to do full arch. So yeah, I mean, I've got more things going on than I know what to do with right now.
Yeah.
And it's good. I work with a really good team that helps me on a lot of that stuff. Yeah, so I mean, I'm excited, but like I said, like this year for me is more of a year to kind of like try to relax a little bit and
Cool.
and just kind of reassess everything and like try to be home.
Yeah, that's great.
So yeah, and not take really surgery CE. Take something different, learn something new.
That's awesome. Yeah. I mean, I think there definitely is like diminishing returns in terms of the surgical courses out there. It's so important to take different courses, learn different approaches and things. But there's definitely something to be said for going back to the basics, the fundamentals that you've been talking about. And there's so much more to learn in that world. So yeah, I definitely encourage people to take a similar route, go back to the basics, and then get more complex from there. So yeah, that's awesome. So one question that we always want to ask, and I know that we already covered a number of controversial topics that may ruffle some feathers, but what's your most controversial opinion in full arch dentistry?
Man, that's a good question. I don't even know. I don't know if I have much of like a controversial opinion. Like I see the sides to everything so much, like I think that what we just spoke about, where it's like, I think there's too many people taking teeth that don't need to be taken out. Like
Solid.
that's, I mean, that's one thing I preach about a lot. And it's like my rule of thumb, where I tell patients, where it's like, if my treatment is not going to last you more than 5 years, then we should look at a different treatment. Because like, if what I'm doing to you, granted, if the patient takes care of it, if what I'm doing for you is not going to last you 5 years, then we should look at something different.
Yeah, fair. Yeah.
And I know some of these massive full arch groups have these crazy consent forms for patients that don't need all their teeth taken out, and patients are, because you can't. And I know of a dentist that has been sued for doing full arch on someone that didn't need it, and going to lose that case. I mean, consent forms are a speed bump, man. Lawyers don't care about consent forms.
Yeah.
I do, something controversial. Like I do think this whole like race to the bottom thing is just going to screw everyone in the long run. And that's kind of one of the things where it's like, in the last 3-4 months, where I've kind of like taken a step back, and it's like, okay, like, what else can I do? Because man, when you're charging such low fees for full arch, like it's just, you got to keep your doors open. Like you've got to pay staff. Like, being a business, like I think one of like the most rewarding things about being a business owner is having employees, like being able
Yeah.
to help other people provide for themselves and their family
Hmm.
is I think is a privilege. And I think people take that for granted that, employees, they deserve a fair wage. They,
Yeah.
like, dude, being a dental assistant's hard. Like
I couldn't do it. I'm not
it's
made of it.
it's a brutal job. Like,
Yeah.
and I don't think that they're appreciated enough. So like, yeah, the office has to make money. Like I have to make money, but my staff have to make money.
Mm.
And to me, that's really important.
Yeah.
So like, that's the other reason I kind of like am looking at other things and potentially like, I will never give up full arch, but like opening my toolbox to other things to
Yeah.
do more profitable things in the office so that like I can have more employees. I can pay my employees better. Like, I mean, like I would love to be I would love to be the dentist that pays their employees more than anyone else,
Yeah. Yeah.
like that to me is like super rewarding.
Yeah.
And so, find the best people and you pay them. So,
Awesome.
but yeah.
Awesome. Yeah, no, that's solid, and there's just a lot to be said for becoming that dentist, and that takes some really good systems and some really sound philosophies and some long term thinking as well. And I think you've definitely laid a framework to build that kind of work environment around you, and have some people who are going to stick with you for a long time. So that's awesome, and yeah, Drew. So I really appreciate you coming on and talking about your journey so far. Has not been a very long journey, neither is mine, but you have done some really incredible things. I would argue you've done more than most do with their entire career, and I'm so excited to see what you end up doing with it. I think you're leading the way for us DCG alumni.
Yeah.
So I really appreciate that.
It's
And
funny.
again, yeah, go ahead.
I had a DCG alumni just hit me up the other day.
Oh yeah,
Yeah, I don't know who it was, but yeah, man,
yeah,
yeah, I love it, man. I think the future of dentistry is bright. Like,
I do too. Yeah,
so it's exciting.
yeah. Awesome. Well, again, man, I thank you so much. You brought a whole lot of wisdom onto the pod today, and we even got out of the world of implants and got a little bit cynical about it, which is fantastic because I think we're due for that. So I really appreciate it. Thank you so much for coming on. Of course, you'd be welcome back anytime. And if anybody's interested in learning more about Drew and everything he's doing, what's your Instagram handle?
It's the_Drew_Phillips.
Okay. Perfect.
Yeah, man, hit me up. Like, ask me questions. Recommend
sure.
CE courses for me because I'm still addicted to CE, and with
Awesome.
people have got good courses to go to. Like, I'd love to go. And
Cool.
the other great thing about CE is where you meet people, man.
Yeah.
Like that to me is like honestly the best part is like the connections you make with people, and that's sometimes more fun than just like, I mean, dude, I went to AID and I went to like 2 lectures.
Oh yeah, yeah.
It's like, oops. Just
Yeah, I
people,
mean,
man.
there's usually some nuggets of information for sure, but we're both going to Orca here this weekend, and I couldn't be more excited. I mean, the lineup is incredible. One of the best speaking lineups I've ever seen, as far as full arch is concerned. They've done an amazing job organizing that, but I just can't wait to see who's going to be there and who's going to be at cocktail hour. So it's going to be really fun.
Sure. Yeah, man.
Cool. All right, man. Well, I'll see you in a couple of days. Thank you so
I
much.
appreciate it.
See ya.